The All In podcast is brought to you by the Urban League of Metropolitan St. Louis in partnership with the National Urban League, the National Action Network, Shea Moisture, and the National Coalition on Black Civic Participation.
I feel really privileged that I get to walk people through and hold their hands through what can be a completely terrifying experience. You have this essentially an alien living inside your body that your body recognizes is different from you. And so you don't want your body to attack the fetus. It's a problem that we have in this country and internationally is that pregnant patients and lactating patients are systematically excluded from clinical research trials. So I'm really grateful that we're on the other side, but I hope and pray that we will remain vigilant.
Hi, welcome to the All In podcast. I'm your host, Pat Washington. Thank you for joining us today. We have a fantastic show planned for you today. We are going to talk about pregnancy and COVID-19. So we have a very special guest joining us today. So we hope you'll sit back, relax, bookmark this show, and subscribe to the feed for the All In podcast. We are all in against COVID, and we want you to be all in too. COVID-19 appears to be on the wane in our community. As a matter of fact, the emergency declaration that was called by the federal government is scheduled to be lifted very shortly. And we've talked before on this show about what that means for us and how does the end of the pandemic, what does that mean for us and how should we conduct ourselves and how should we continue to safeguard our health? And so today we want to talk about a very special population that should continue to be vigilant, should continue to monitor their health. And one thing is clear, and that is COVID-19, the emergency declaration may be over and the pandemic may be over, but I think COVID-19 is here to stay. So we want to find out how we can protect ourselves, how we can protect our community. So today we'll talk about pregnancy and COVID-19, and we'll talk a little bit about COVID's impact on pregnant people, understanding some of the protections, some of the medical care, some of the issues that came up during the pandemic, and what we can do now, even as the vaccinations are out and even as COVID-19 appears to be on the decline in our community. We have a wonderful guest today, as I stated, Dr. Ebony Carter. She is at Washington University High-Risk OBGYN at Barnes-Jewish Hospital. And so she's going to help us sort it all out and give us some great information about how we move forward. So stay tuned to the All In podcast. We'll be right back.
I encourage my patients to get vaccinated against COVID-19. Vaccinations protect you from this serious disease. If you're trying to become pregnant now or plan to try in the future, you can get COVID-19 vaccines. Learn more at cdc.gov.
Welcome back to the All In podcast. We're glad you could join us today. We have Dr. Ebony Carter with Washington University High-Risk OBGYN practice at Barnes-Jewish Hospital. And Dr. Carter is going to help us walk through this whole idea of pregnancy and COVID-19 and what we need to be vigilant about and how you can protect yourself and those people that you love and that you care about. So please join me in welcoming Dr. Ebony Carter to the All In podcast. Hi, Dr. Carter.
Hi, thank you so much for having me.
So tell us a little bit about yourself, about what you do with Barnes-Jewish Hospital at the high-risk OBGYN practice that you're involved in.
Sure. So I practice maternal fetal medicine. So any pregnant patient who has an issue that makes them too complex to be seen by a midwife or a general obstetrician would come to me. Or if their fetus has an issue, say there's a structural issue with the heart, then they would come to my practice. I'm also the chief of our division of clinical research that supports all of the research functions that are happening for OBGYN here at WashU.
Just hearing you say that, when I think about all of the specialties and all the things involved in just that one practice, that is a lot, and it is critical care.
It is. And, I feel really privileged because I can go into an anatomy scan where people are all excited and what's the gender of the baby and they can't wait. And when I walk in, often it sucks the air out of the room, right? Because it's news that nobody wants to hear when you have these hopes and dreams for this pregnancy and for this baby. But I feel really privileged that I get to walk people through and hold their hands through what can be a completely terrifying experience.
Well, I'm glad you said that part because it does. Yeah, I can remember being pregnant and I can remember all the things that I obsessed about and worried about. So I think just having someone like you there to do exactly what you just said, hold their hand and walk them through and give them the comfort and the peace of mind that they need is really critical. So thank you for the work that you are doing. We really appreciate that. So today we want to talk about pregnancy and COVID-19, and we'll talk a little bit about COVID's impact on pregnant people, how to safeguard their health, because we know that pregnant people who have COVID-19 or who may be exposed to COVID-19 are at higher risk for having complications during their pregnancies. Can you tell us a little bit about COVID-19 and pregnancy and some of that impact?
Sure. So, the human body is wonderfully made. And when we're pregnant, these adaptations happen to essentially protect the fetus. So, you have this essentially an alien living inside your body that your body recognizes is different from you. And so, you don't want your body to attack the fetus. And so, your immune system gets tamped down, which is wonderful for the fetus. That's not so great for the pregnant patient because if you get the flu or COVID or any type of infection, your body is not as able to fight it as if the same you who wasn't pregnant a few months before. And so that's why, during flu season, we encourage people to get vaccinations. During COVID, even at the beginning, we were encouraging people to get vaccinated because the pregnant body just is not as equipped to fight infections like COVID.
So, when we talk about the impact of COVID-19 during pregnancy, what are some of the things that a person might experience, or what might we want to be on guard against?
Sure. So, there's the issue of the infection, and pregnant patients are more likely to get severe infection for all of the reasons that I just said. And so, what does severe infection look like? It means that you were walking down the street perfectly healthy a few days ago, and now you're in the intensive care unit needing a ventilator or a machine to breathe for you, or ECMO, which is kind of like a heart lung machine that basically functions for your body if you can't do it for yourself. Even as a high risk obstetrician, I had no experience with ECMO before the COVID pandemic. We all became experts in ECMO, where we had pregnant patients on essentially heart lung bypass machines because their otherwise completely healthy bodies had been racked by COVID and had severe infection. So, I think that it can't be overstated enough that pregnancy is a really high risk factor for severe disease with all of those things. And the worst thing on that list really is death. I also want to say that, 90% of pregnant patients who get COVID end up having a mild to moderate infection and they're totally fine. But those other 9 to 10% can get extremely sick. And during the pandemic, the intensive care unit was on my rounds regularly. That's a place we don't like to have pregnant patients. And on a daily basis, we were going to the ICU to see 2 to 4 patients at the height of the surges in the pandemic.
So, what kind of impact does that have then on the fetus? We've talked a little bit about what that means to your body when you're actually pregnant, but what does that have? What impact does that have on your unborn child?
So the risk of complications with pregnancy significantly go up when you have a COVID infection. So things like preterm birth, preeclampsia seem to be more common, and it would often get confusing because a lot of the symptoms of preeclampsia, like elevated blood pressure or your liver starts letting off chemicals saying, I'm hurt, I'm injured, that actually happens with COVID too. So sometimes it was hard to make the diagnosis, and things like maternal mortality and death. So all of those complications were higher. The risk of the pregnant patient passing the virus to the baby, that actually didn't happen very often, but there did seem to be an increased risk for stillbirth. So, there were some negative studies, some positive studies, but net, I would say there's probably an increased risk of stillbirth with COVID infection also.
And do we know information now about maybe longer term impact?
So it's interesting because I remember counseling patients and recommending vaccination in pregnancy, even in the early days when we didn't have a lot of data, just based on what we knew about other infections and vaccination in pregnancy. And I remember people saying, that's experimental. I don't want to do it. I don't want to do anything that can harm this fetus, which I totally understood. And the irony is that if you look at the most recent studies that are coming out, when patients had COVID infection in pregnancy and now they follow those offspring, 2-3 years out, if you're looking at neurodevelopmental outcomes in those children now, when their moms had COVID in pregnancy, they're worse. And so, we theoretically said at the time, and I think that's been borne out in the data now, if you have to choose between the, impact of infection with COVID when you're pregnant or vaccination when you're pregnant, you take a vaccine every day. The risks are significantly lower than getting infected.
Well, and I'm glad you said that because I do want to touch on that a little bit. We know that, especially in the African American community, the impact, but people still didn't want to get that vaccine. They were just not going to do it. Like you said, it's experimental. We don't know enough about it. I don't know how that's going to impact my body. So, what impact did that have on pregnant people? Did you see, that hesitancy? Did you see that have an impact, especially in prenatal care?
Yes, and it was devastating. So I remember in, December of 2021, when the vaccines first became available for healthcare workers. And even then, you looked at all the professional societies for obstetrics, and everybody was recommending vaccination because the risk associated with the vaccine were theoretical, but the risk associated with infection with COVID were real. And so, I mean, we were recommending it, but at the same time, I had to say to patients, if you don't want to get it, I understand because I don't have good data for you because a problem that we have in this country and internationally is that pregnant patients and lactating patients are systematically excluded from clinical research trials. So they were right. I didn't have any good data to say what this did in pregnancy. That was a fair argument from patients. But now, several years into this, we have more data on the COVID vaccine in pregnancy than probably any other vaccine. And time and time again, it's borne out the fact that it's safe and it's infinitely safer than getting COVID infection. But I will say that hesitancy had terrible consequences. Oh, the patients who were in the ICU knocking on death's door saying, I wish I had known. I wish I had gotten vaccinated. Right. Like, and by then, it's too late. And so I think that pregnant patients bore a huge burden of COVID infection unnecessarily because one, we excluded them from clinical trials. And number two, people were so hesitant that the people who were most likely to get really sick were least likely to get the preventive measure that we had for them to try to keep them and their fetus from getting sick.
So, what were some of those? I heard them a lot. Some of the myths and the misinformation and disinformation, and how did that impact? Because there was a lot out there.
There was a ton. I feel like the social media misinformation beat us out on the medical good information. I mean, I remember one of them was like COVID will mess up your fertility. Like, it'll make you infertile if you get the COVID vaccine. And I remember doing a talk around that time, and they said it was because one of the proteins in the vaccine looked like a protein on the placenta, and it would attack it, and all of this foolishness. And so I put a picture of the proteins next to each other, and I'm like, it's the equivalent of saying that Mickey Mouse is the same as Donald Duck just because they're cartoons, but they actually looked completely different. And this went viral. People were acting like, oh, that you're not going to mess with my fertility. Yeah, there was a lot of misinformation, and I
I'm
feel
going to
like,
need to see that picture.
oh, I have a slide. I can pull it up for you. But I feel like how many deaths could have been prevented if we had had good information out there for people. Because there's no question, like as a high risk obstetrician, my job constantly is weighing risk and benefits for both the pregnant patient and the fetus. Like that's what I get paid to do all day, every day. And this one is a no brainer. Vaccine over COVID any day.
Well, I'm going to need you to put that in a PSA. We'll probably have to take that as an outtake and use that forever now going forward. So, do you still see, even what we are 3.5, 4 years in, do you still see some of that hesitancy, or are you still working to combat a lot of that distrust?
Definitely. I mean, I think a good example is, things seem to be getting better under control now, but the last kind of surge that we had, um, or even in the fall, we were encouraging people to get boosters, right? Like there were new variants coming out, the boosters were covering it better, and we were saying, okay, go ahead and get this, and folks didn't want to get the boosters. So I think it's still there. I think the main difference, though, is like it or not, all of us have probably gotten vaccinated or infected at this point. So there's some protection there to buffer it versus when we were having these conversations 2 years ago, people had no protection. Well, one other thing I wanted to raise is I don't want us to get complacent because, in my hospital, we just removed the mask mandate. It's nice to be walking around and not breathing in your own bad air all the time. So it feels like life is finally back to normal. But COVID is smart. There are variants. It figures out how to mutate. And so, just like every now and then we have a bad flu season where everybody gets sick, I expect that similar things will happen with COVID, where it kind of like flares up over time and comes back. And the vaccine hesitancy that we have had has not served us well. And I will say, in particular, for the Black community, the Black community has very good reason to be skeptical of the medical system for past and present injustices that have happened. And so I don't blame people one bit, but it's coming at a personal cost because outcomes are worse because we're not getting access to a really good, easy preventive measure that has minimal side effects.
One thing I wonder is, should we be having uh, ongoing marketing and messaging and educational outreach, not just to pregnant people, but to everyone about COVID-19 and about the efficacy of the vaccines and the boosters? Because I still think that's a an issue that still permeates in communities, especially those of communities of color, where people are hit hardest.
Yeah, I completely agree. And yes, and the thing is, it's not just COVID. I would make exactly the same arguments that I just made for COVID. I would also make that for the flu. And when I was talking to people, this was earlier on before we had overwhelming data of like why this is the right thing to do. But the other thing I would say to people is, okay, so let's say that you don't want to get the vaccine now, and you're like, okay, I'll get it after I have the baby. That's great for you. That's not such a good strategy for the baby because the baby is not going to be able to get a vaccine. The baby is not going to qualify for that vaccine for months. And at the time, it was like 5 and 6 year olds. So I mean, it was going to be years before the baby will qualify. The only shot that baby had any protection against COVID was if we gave the vaccine to mom. Mom's body created the antibodies. Antibodies are the soldiers that kind of mount up and they go fight infection when they see it. The baby's only hope for getting that was either getting it passed through the placenta while mom was pregnant or by lactation. So you pass it through breast milk. You can pass those antibodies or those soldiers for infection through breast milk. And so that was one of the other things. It's not just about what's happening here. I have two patients. And so there's also positive benefits for the fetus and then the baby through vaccination for the birthing person. Um, okay, so I'm going to go real big picture on you because the people who were most likely to get severe disease in pregnancy were those who had other medical problems. So,
Hmm.
diabetes, hypertension, obesity. If you look at the people who were dying during the pandemic and were pregnant, most of them had some other issue that was going on as well. So, I'd say, even though I'm a high risk obstetrician, the before and the after, we don't spend most of our lives pregnant. And so I think that good pregnancy outcomes actually happen in the before and in the after. So that's one of them, is just being as healthy as possible. And then, mask mandates have fallen off, but if you're pregnant and you're in a really crowded place, like a concert or whatever, you might still want a mask in those like conditions where you're more likely to be exposed and kind of in close proximity. And then the other thing is, if you do get infected, don't just like sit at home and be like, okay, I'm just going to wait this out. There are actually medications that can lessen the severity of the infection once you have it. And so you really should reach out to your obstetrician, because if you have it, we want to protect the other patients in our waiting rooms. But, call your physician or midwife or whoever you're seeing, because there are things that we can do to decrease the likelihood of you having severe infection. And you qualify for these other medications because pregnancy is one of the qualifiers for, severe infection and getting access to those medications.
So there's something that I am concerned about. We've been having conversations about the end of the emergency declaration and what that's going to mean, especially for those people who are on Medicaid or who are on some kind of subsidized care, and they may not be able to get access to medicines or doctors as easily as they were when this emergency declaration was pronounced. So is there any concern about that? What should people be doing? I know that there was a big push to make sure that people were registered for Medicaid and had renewed for Medicaid. What should we be telling that particular population? Because in Missouri, there's a significant number of people who rely on Medicaid for healthcare.
Yes. So pregnancy is a qualifying condition for Medicaid. So when we have patients who come in for a new obstetric visit in our clinic, we actually have an emergency Medicaid specialist who will help them get registered for insurance. And so at least during pregnancy, you don't have to worry about not having health insurance coverage. But as soon as you deliver that baby, 45 to 60 days later, the vast majority of our patients are once again without insurance and have all of those issues again until the next pregnancy. So I would say that during pregnancy, people are covered. But you can tell my bias in this. Healthcare is really a right, not a privilege, and we need to cover the before and after if we're really going to take good care of people.
And so you talked about a right and not a privilege. And I agree with you 100%. And I think that there are so many people who don't recognize as and patients that it's okay to advocate for your health care. It's okay to advocate for your needs. And I could see why that would be particularly important for this particular population because again, as you just said, you have two patients.
Hmm. Yes.
So what there's just a couple more questions I have for you and then we'll wrap up. What should we be thinking about moving ahead after May when the emergency declaration is over? What advice do you have and what would you like to see as we move into less of an emergency phase and more almost like a seasonal type, as you said, with the flu?
One is, the half of pregnancies in this country are not planned. But for people who are planning a pregnancy, or even those who aren't, get vaccinated. Like if you don't want to get vaccinated when you're pregnant for whatever reason, despite the data and everything else, then go ahead and get it done before you get pregnant. So that's one thing just in terms of like pregnancy intention. And then I think this needs to be part of a broader conversation. COVID is here to stay. It's going to be with us just like the flu and other viruses that we get every single season. And so I think we need a larger conversation as a country about public health, about preventive care, and about vaccination programs. And so, there are several vaccines. I think part of the reason we felt comfortable with the COVID vaccine is because we give the flu vaccine in pregnancy. We give the pertussis vaccine in pregnancy. And pertussis, it's actually not even for the patient. That is purely for the baby because we need the baby to get protection, and the only way we can do that is to give it to the pregnant patient. I think we need to have a frank conversation and some education around vaccines, and the fact that they get a really bad name. But we are all really lucky. Most of us never had measles, mumps, or rubella because we had a vaccine. And I think that messaging is lost.
Now, this one, it's a little risky for me, but there are people who say, I'm not getting the vaccine, I'm going to be organic. And they come up with all these different home remedies. I'll just say that home remedies are natural remedies, and sometimes that's not the most helpful. Is there any advice for those people who really do want to do something that's more organic, um, and maybe whether it's diet, anything, any advice for them?
I mean, I feel like when people say like I'm going to do something more organic, that means I'm going to get COVID. Like that's the organic option. So I gave an analogy early in the pandemic, which was if you're on a freeway and you are racing down the freeway at 70 miles an hour, and there are only two exits off this freeway, right? Like all of us have to get off at some point, and it's the COVID, it's the pandemic freeway. Two exits. The first exit, you get the vaccine and you have a nice safe passage. You might have like a fever, chills, you might have fatigue for 24 hours. Like you don't feel great, but it's a day and you get off, you're fine, right? Or the other exit is you get COVID. And that exit that's COVID, for every 100 cars that exits that freeway, one is going to result in a fatal crash. Which exit do you choose? The one where one out of 100 cars like is dead, or the one that is actually safe and just a little bit inconvenient? And that is the decision. I think we're at a point now where people have gotten infected, so it's probably less of an issue. But I mean, I think when you put it in that framing, none of us would take an exit off of the interstate if you knew that one out of every 100 cars was a fatal crash. But that's exactly what we have done during this pandemic.
We've been talking with Dr. Ebony Carter. She's at Washington University with the high-risk OBGYN practice at Barnes-Jewish Hospital. And we've been talking about COVID-19 and the impact on pregnancy and how we can safeguard our health and protect our community. So Dr. Carter, how can people learn more information? How can they understand more about what happens with your practice at Barnes-Jewish Hospital? And if they just want to reach out for more information?
Sure. So on our Washington University OBGYN website, if you just Google it, we actually have an entire section devoted to COVID, including a little cartoon about the COVID vaccine and how it works. Because I think we get scared of things that we don't understand and we don't know. And the cartoon kind of breaks it down so that anyone can understand it. So that's available as a resource. The other thing is things are changing all the time. The guidelines, the recommendations, how often you get a booster. It's hard to stay up to date. And so the Centers for Disease Control and Prevention website has some, kind of the medical complex jargon things, but it also has patient facing information. So if you want to know like the latest guidelines or what you should be doing, the Centers for Disease Control and Prevention is going to be a really good resource.
And I just cannot thank you enough for coming on and having this conversation with us. It's been wonderful to listen to you and understand your perspective. And I just appreciate so much the work that you and all your colleagues are doing there at Barnes-Jewish Hospital to make sure that those babies get here, they get here healthy, and you take care of everyone involved. So I want you to take good care of yourself because, sometimes it's the people who give the care who don't often receive the care. So making sure that you are balanced and you're cared for. And so thank you again for joining us on the All In podcast. And we're going to let you have the final thought as we close out. And we just consider this your home. And if there's additional information that you'd like to share, if there are issues that come up as we move, because as you said, COVID-19 is here to stay. And so we'd love to have you back.
Thank you so much for having me. I really appreciate it. And I feel like it's been a traumatic 3 years in a lot of ways. I think for, us as a society, us as physicians taking care of these patients. So I'm really grateful that we're on the other side, but I hope and pray that we will remain vigilant because this is not going away. It's here to stay. And we're really blessed that there are some amazing tools, both vaccines for prevention and medications if you get infected. So don't stay at home pregnant and infected by yourself. Like call us, let us know so we can take good care of you.
I think that's wonderful. And it's what you said earlier, 90% of those pregnancies are going to be fine, but
Yes.
You want to take care of those that might have a problem.
Totally. Thanks for having me.
Thank you. We appreciate. That's going to do it for this edition of the All In podcast. I'm Pat Washington. We want to thank the National Urban League and the National Action Network and all of our sponsors at the All In podcast. And we'll see you next time. Thank you for joining us.
The All In podcast is brought to you by the Urban League of Metropolitan St. Louis in partnership with the National Urban League, the National Action Network, Shea Moisture, and the National Coalition on Black Civic Participation.